Hello, everyone, and welcome to my health and wellness channel. I'm Dr. Gauri Bhide, and I'm a medical oncologist. We've been addressing sleep issues as it is such a common problem. The lives we are leading, the daily stresses, the change in our circadian rhythms, the constant exposure to electronics are among the many causes of our sleep issues. But besides insomnia, there is another sleep condition that is a medical condition and causes medical conditions, and that is sleep apnea. What is sleep apnea and what differentiates it from insomnia and sleep deprivation? Sleep apnea is a fairly serious medical condition that causes the person to have repeated pauses in breathing of at least 10 seconds per episode all through the night. You can try this now. Hold your breath for 10 seconds and think this is happening multiple times during the night. This leads to a drop in oxygen levels, which can lead to many medical issues. And because of the interruption in breathing, the quality of sleep is very poor and leads to daytime sleepiness and fatigue. There are two main causes of sleep apnea. One is obstructive sleep apnea, where there is a physical obstruction to the airway, and this is exacerbated during sleep. And the second is central sleep apnea, where the brain signals to breathe in and out are faulty. These could be due to a neurological condition like a stroke. For the purposes of this video, we will focus on obstructive sleep apnea or OSA. As we've previously noted, sleep issues are very common in our modern world. How do we go about diagnosing sleep difficulties? Some of the questions we can ask our tired patients are: do you feel very sleepy during the day? And is daytime sleepiness a problem for you? Do you take naps? How many and for how long? There is an Epworth sleepiness scale where you add up your point score in your answers to several questions. Are you sleepy and nodding off when you are sitting and reading? When you're watching television? When you are sitting inactive in a public place? When you are sitting for an hour in a car as a passenger? When you are laying down to rest in the afternoon? When you're talking to another person? When you're sitting quietly after lunch when you've not had any alcohol for lunch? When you're sitting in a car stopped in traffic for a few minutes? If you have 1 to 6 points, this is normal. 7 to 8 points is average sleepiness, but 9 to 24 points signifies a problem. There is another questionnaire called the Stop Bang questionnaire, which again gives you a score based on your answers. This stratification of risk helps us determine who needs to go to a formal sleep lab for a sleep study and who can be diagnosed at home with a home sleep study. There are professions where you don't want to risk having them fall asleep on the job, and these people need formal sleep studies like airline pilots, bus drivers, ambulance drivers, for example. People who need a sleep study in a lab are those with moderate to severe symptoms, those who have other medical conditions like heart failure, COPD, or who have concerns about central sleep apnea, and who are on medications like opiates. The sleep lab provides the most definitive test. Why are we worried about sleep apnea? If you are falling asleep during the day, you are 2 to 3 times more likely to have a motor vehicle accident. Sleep apnea can worsen cognitive function and executive function, which can worsen your judgment, and you can have errors and cause accidents. Sleep apnea can worsen cardiovascular disease like hypertension, coronary artery disease, cardiac arrhythmias, heart failure, and pulmonary hypertension. Sleep apnea can worsen insulin resistance in type 2 diabetics. Studies have shown that sleep apnea patients have increased inflammatory markers. And there are also studies that show that obstructive sleep apnea can worsen the risk of developing gout and fatty liver disease, even if there are common risk factors that cause both, like obesity. Besides daytime drowsiness, what else do patients with obstructive sleep apnea complain of? They, or rather their sleep partners, report extremely loud snoring, often so loud that their partners need to sleep in a separate space. This snoring needs to be differentiated from regular primary snoring. They can experience a choking or gasping sensation, but this needs to be differentiated from reflux disease, which can also cause a similar choking sensation. Daytime drowsiness needs to be differentiated from regular fatigue. Obstructive sleep apnea patients often wake up with a bifrontal headache, but this is not accompanied by photophobia or nausea. These headaches need to be differentiated from those caused by a brain lesion. Patients often wake up with a dry throat and a dry tongue because they often sleep with their mouth open to compensate for the obstruction to their nasal passage. Nasal congestion is a common finding, as well as obesity. The risk of obstructive sleep apnea increases with obesity. Men are 2 to 3 times more at risk, and the risk increases with age and levels of around your mid 60s. There are other risk factors like craniofacial abnormalities, enlarged tonsils and adenoids, smoking, and medications like benzodiazepines, opiates, and alcohol, which can all worsen this condition. What are some other non respiratory sleep disorders? Narcolepsy, movement disorders like restless leg syndrome, or severe insomnia, which we have reviewed elsewhere. What is a sleep study? This is also known as a polysomnogram or a PSG. In a sleep lab, the patient sleeps while connected to a variety of monitoring devices like an EEG to record brain waves, an EMG to record rapid eye movements, and an EKG for cardiac monitoring. We also monitor oxygen and carbon dioxide levels. Patterns of physiological abnormalities during sleep may be diagnostic of sleep disordered breathing as well as many other sleep disorders. You will be given instructions on abstaining from caffeine and sometimes alcohol and how and when to take your regular medications before you come to your sleep study. If you're anxious about being able to sleep in a sleep lab, you may be prescribed a sleep aid to take at home the night before and then again in the lab. You should not be allowed to drive yourself home after the sleep study if this is completed in the middle of the night. A technician monitors the variables, records any abnormal movements, records snoring, and sometimes a second night of studying is required with additional positive airway pressure. If you are diagnosed with sleep apnea, this should be treated to prevent further deterioration in heart, lung, and brain function. First, you should take care about driving and using heavy machinery as you are at greater risk for having accidents. Then, behavior modification can be instituted. For overweight patients, weight loss, exercise, and even bariatric surgery is helpful. Changing sleeping positions is helpful if certain positions worsen sleep apnea. Avoid alcohol and other medications like benzodiazepines, antihistamines, and opiates. But the main treatment is continuous positive airway pressure. This involves wearing a mask connected to a machine which delivers pressure to keep your airways open and prevent airway collapse. There is high quality evidence from randomized trials and meta analyses that in most adults, including the elderly, positive airway pressure reduces further frequency of respiratory events, daytime sleepiness, improves blood pressure, and lowers the risk of accidents. Some data also suggest that positive airway pressure therapy can improve symptoms of reflux disease and heart failure and reduce the risk of recurrent atrial fibrillations and nocturnal arrhythmias. There are other modalities instead of continuous positive airway pressure, such as intermittent pressure and other machines that can be triggered by snoring. However, a treatment is successful only if there is good adherence. Apparently, 20 to 40% of patients don't use their device at all or use it only intermittently. Troubleshooting about any issues using the device can often solve a lot of the roadblocks regarding usage. This needs good follow up after diagnosis and initiating a CPAP machine. People with mild to moderate sleep apnea may choose to use oral appliances to keep the upper airway open. Some may opt for surgery if there is an obstructing lesion. Some patients may use a hypoglossal nerve stimulator device. And there are some drugs that may directly stimulate the respiratory drive. All these alternate treatments are reserved for those who will not or cannot use the CPAP machine or have failed them because of their physical factors. For those who use their machines, they say it has been life changing. They are sleeping much better and they are much more awake and functional during the day. That itself sounds worthwhile to me. I hope you found this information useful. Do comment below and hit the like button, and do subscribe to my channel for more interesting and useful information coming your way. Take care and be in good health.